So when you first turn 65, or maybe you're past 65 and you're about to retire, you may be stuck with a very important dilemma. What do I do with my health insurance? Do I go with the Medicare Advantage? Do I go with the Medicare Supplement? There's a lot of noise around this, so hopefully today we can really dummy this down because they do make it confusing. I see a lot of videos online and a lot of posts on social media with a bunch of numbers and charts and diagrams and graphs and whatnot, and it makes it very confusing. It's like you're reading Chinese almost. And so today I really want to try and make this as simple as I possibly can, so hopefully this can help you make a decision. But before we talk about the differences, real quick, I'm going to talk about Original Medicare for those of you who may not be familiar. Original Medicare is made up of Part A and Part B. Part A is hospital and Part B is medical. Now, for most people, there will not be a premium associated with Part A. However, for Part B, there will be. And for this year in 2025, we're looking at $185 as the standard monthly premium for Part B, although that can increase dependent on your income. And so Part A and Part B come together, they fit like a glove, and they cover 80%, leaving you with 20%, and that is unlimited, no cap. And so as you can see, if you have a $200,000 bill, owing 20% of that might put you in a bad spot. I know it would for a lot of people. So that's where you either go with a Medicare Supplement or Medicare Advantage. Now, to enroll in an Advantage or a Medicare Supplement, Part A and Part B have to be active. So that's important to know as well. Now, first, we're going to talk about Medicare Supplement or Medigap, as it's commonly called as well. And so when you go with a Medicare Supplement, that is supplementing Original Medicare. So Original Medicare is going to be primary, and your Medicare Supplement is going to be secondary. And so when you do that, now you have access to Original Medicare's network, meaning you can go to any doctor, hospital, facility in the country that accepts Medicare, which is awesome. The most common Medicare supplements that a lot of people go with, the most common ones are going to be Plan G or Plan N. And we won't really discuss these too in depth today. I will give an example, and we're going to talk about Plan G real quick as the example. For this year, Plan G has a $257 deductible. So you have a premium for that Medicare Supplement Plan G, and that Plan G has a deductible of $257. Once that $257 is met, you are then covered at 100%. So as you can see, your costs to use a Medicare Supplement may be a lot less than plans we will discuss, and we'll talk about some pros and cons of both of these. Now, you may be asking, well, how much is a Medicare Supplement? And that really depends on how old you are and where you are in the country. So that premium can change quite a bit. When you go with the Medicare Supplement, you also have to purchase a prescription drug plan known as Part D. And that, in many cases, may have a premium as well. It really depends on the medications you're taking. So you're going to have Part A and Part B as primary, your Medicare Supplement as secondary, which will have a premium, and then prescription drug plan that may also have a premium as well. Now, some pros and cons of the Medicare Advantage. Well, first off, the network is huge. You can really go anywhere in the country that Medicare is accepted, which is a majority of places. You have a very low out-of-pocket, like I said, on a Plan G, a $257 deductible for the year. And they are guaranteed renewable, meaning they're not going to kick you off the plan. You don't have to keep renewing your plan. It just automatically goes, and we'll talk about some nuance to that. The cons of this plan may be the cost. Some people may not be able to afford a Medicare Supplement, as they will go up, which is another con, is every year your premium on your Medicare Supplement will increase. Another con is you have to get a prescription drug plan, which may add some extra costs. And the final con to a Medicare Supplement is you don't get the extra benefits. You don't have coverage for dental, vision, and hearing. If that is something you want, you have to purchase that on your own separately. So that's high-level view of the Medicare Supplement. If that's the route you go, Hopefully this kind of helps identify if that's a good option for you or not. Your other option you can go with is your Medicare Advantage, also known as Part C. And if you go with the Medicare Advantage, you are no longer part of original Medicare. Now you still have to have Part A and Part B, but now you're purchasing a Medicare Advantage plan through a private health insurance company. Now they're primary. And so you're no longer going to have original Medicare as your primary insurance. That is all now through the private insurance company. And when you do that, and when your primary is through the private insurance company, now you're subject to their laws, essentially, meaning you're now going to have a network. Unlike the Medicare Supplement, you can kind of go anywhere in the country. A Medicare Advantage, you will have a network. A lot of plans are going to have HMO or PPO options, so you will have to be within that network. It's very similar to plans that you may have had through your work. And so when you go with the Medicare Advantage, you're going to have copays and a max out of pocket. Most of the Medicare Advantage plans are $0 a month. There can be some nuance to that, but that's a standard, is about $0 a month. The standard out of pocket, now this depends on what plan you choose and where you are in the country, but that out of pocket can range from $4,000 to $9,000 a year. Just depends where you are. Now, with that Medicare Advantage, you have prescription drug coverage included. A lot of the times they will have dental, vision, hearing, over-the-counter benefits, things like that are already bundled into the plan as one. And so instead of having to purchase all of that separately like you do on a Medicare Supplement, on the Medicare Advantage, everything's already included in your plan. And so the pros of a Medicare Advantage is, number one, going to be a lower cost in most instances than the Medicare Supplement plan. You're going to have the extra benefits already included that we talked about: dental, vision, hearing, prescription drug coverage. And so you're going to have everything already in one, and a lot of the times it's $0 a month. Now, some cons to the Medicare Advantage: maybe your network. You're not going to have as vast of a network like you may have on a Medicare Supplement, but a lot of the times now there are nationwide PPO options that is a little bit more flexible for those people that want that bigger network. Another con is every year you will have to renew your plan or choose a new plan, and benefits can change from year to year. So that's a con that you may have to go through. Another con is prior authorizations on a Medicare Advantage, as I'm sure a lot of you have heard of or know about. And another con could be those out-of-pocket costs. Now, if you don't use your plan, or maybe you find a plan with a super low out-of-pocket, may not be a huge deal, but there are plans that have a bigger out-of-pocket, and so that can be a con as well on the Medicare Advantage. Now, that sums up my video today. So, supplement versus advantage. And I'm going to make other videos kind of talking about each one separately, and maybe I can dive a little bit deeper, but I know less information can sometimes be more helpful than throwing a bunch at you at once with a bunch of numbers and examples and things that just goes way over your head. So hopefully this video helped. So if you're in that transition period, you're going to have these two options: a fork in the road, Medicare Advantage or your Medicare Supplement. And this video hopefully is going to make that decision a little bit easier for you guys. So I would like you to drop a comment down below. Tell me what plan you have. Do you like your plan? Do you not like it? What would be your opinion, or what would be your option if you were turning 65? And please like this, comment, share this with someone that you know. I'm going to be dropping a lot more videos diving into different topics of Medicare.